pig.
I'm about to break some life or death news to the people that are gathered here. Now, I may look or even feel perfectly normal, but I'm actually carrying a potentially lethal disease that had been spreading around this normally quiet, leafy little town. And the locals are gathered here to find out whether I've infected them. And I've got to say, they all look remarkably happy about it.
That's probably because it's part of the biggest experiment of its kind. With the help of thousands of volunteers, we are about to simulate the outbreak of a fatal contagion throughout the UK.
That might seem like a funny thing to want to do, but if I can succeed, this will save lives when, not if, a real pandemic hits. Now, the infection started here in Hazelmere.
Hazelmere in Surrey.
Citizens of Hazelmere!
We want this small town to give us a close-up view of an outbreak. Watch how a virus spreads from one person to the next.
Take part today and sign up!
If we can spread a virtual contagion through Hazelmere, this unprecedented detail can be used to test the best ways to stop an outbreak. Who should be vaccinated? Should schools be closed? Or places where people gather?
To infect you all, there had to first be a patient zero, which you may have guessed was actually me.
Our pandemic virus spread like wildfire because no one was immune. If this had been a real virus, the town would have come to a standstill.
I expect a lot of you will know Dr. Hannah Fry. She's always a popular figure in Number 5 videos, and she's also been here on the podcast before talking about her life and research. But what you might not know is that in 2018, she hosted a special program on the BBC all about pandemics. The show told us of a looming crisis. It even foretold a spiky-looking flu virus that would mutate, start in Southeast Asia, and spread through the world with astonishing speed and devastating effect. It would take lives and alter our way of life. It wasn't a matter of if, but when. 2 years later, and unfortunately the BBC and Hannah have been making, well, a sequel of sorts, and this time, it's for real. Today, Hannah's sharing some of her thoughts about the current pandemic and why innocent mathematicians will probably end up getting some of the blame. So, Hannah, a few weeks ago, before things got really serious here in the UK, I watched the Hollywood movie Contagion. Mm-hmm. A lot of people have been watching that, and a lot of people are watching it thinking, "Oh, this is so prescient. There's so much sort of 'I told you so' about it." Mm. Well, about an hour and a half ago, I watched another film called Contagion that was made by BBC4, a great team of people. Mm-hmm. You are the presenter of it.
I certainly am.
It was broadcast in 2018, and that is crazy prescient. Like, it's almost like a joke how much everything in that documentary and all the things you talked about have are being exactly duplicated now.
It's quite spooky, isn't it?
Spooky indeed. What are the odds that the small market town of Haslemere played host to Patient Zero in both the simulated BBC pandemic of 2018 and the real deal 2 years later? I don't know the answer to that, but I bet Hannah Fry could work them out, and I bet they are pretty damn long. On the day the news broke of the first community transmission of COVID-19 in the UK, everything changed. This was the moment when the starting pistol on the pandemic was fired, and grim-faced newsreaders began the daily ritual of announcing the ever-mounting death toll to an increasingly terrified nation. So, what's going on here? Is it just a spooky coincidence, or is there something more to it? Let's go back to the BBC pandemic simulation exercise to look at it in more detail. It's still available to watch in full on YouTube, and it's definitely worth 1 hour 14 minutes of your life. And all the show notes are still available too. You can see straight away that a lot of work has gone into this production. Commissioned by BBC4 to coincide with the centenary of the 1918 Spanish flu pandemic, and fronted by trusted and well-recognised presenter Hannah Fry, it says here that she sets out to recruit the nation to download the BBC Pandemic app in a groundbreaking experiment to help plan for when the next deadly virus comes to the UK. And here it says that Hannah masterminds the experiment and adopts the role of Patient Zero by walking the streets of Haslemere in Surrey to launch the outbreak. Now, I'm not sure Hannah Fry really did mastermind this experiment, but she was certainly pushed centre stage into the role of Patient Zero, and you can see why. She's a very experienced and talented presenter with a natural style, and her academic credentials mean she can speak with genuine confidence and enthusiasm about her subject. Watching the documentary, I get the feeling that she's not altogether comfortable acting the role of disease super spreader for the BBC. I could be wrong about that, but either way, she had a team of trusty academics on her side. Here they are, more on them later. So, the idea of the experiment was to simulate the next pandemic using a smartphone app.
Smartphones are the perfect tool for pandemic research. Forget the phone bit. It's the combination of a built-in GPS tracker and specially designed apps that make them a data gatherer's dream.
Volunteers were recruited from across the UK to download the app, and once Hannah Fry had seeded the deadly infection around Hazelmere, the digital pathogen passed via the phones to those who interacted with one another for a certain length of time. Does that sound familiar?
On to Britain now. The government thought the pandemic was on the decline. They loosened all the restrictions and celebrated Freedom Day this week. Since then, British phones have been buzzing like crazy. Thousands of people are being pinged for possible contact with an infected person. It's being called a pingdemic.
Just days after England lifted the last of its COVID restrictions, a so-called pingdemic has dominated headlines here. The move has led to hundreds of thousands of people having to self-isolate because they've come into contact with someone who's tested positive for the virus. But how exactly does it work? People in England and Wales can download an official COVID-19 app on their phone. So far, around 26 million people have done so. If John tests positive for the virus, anyone he's spent enough time with who also has the app active will get a ping telling them about his result. But only those who've been in close contact with him, that's 2 meters away for a minimum of 15 minutes, will receive a message.
As an aside, it's worth taking a look at the production company that was hired by the BBC for this programme. This is it, Belfast-based 360 production. Now, I tried to do some digging into this company and I didn't get very far, but this is the interesting bit. Big Motive, also based in Northern Ireland. Big Motive is the company that developed the BBC Pandemic app, and look at what they're up to now. Designing an award-winning contact tracing service to fight the pandemic for the Department of Health. Category winner of the IDI 2020 Awards. The world's first working cross-border solution and first contact tracing app for usage by 11 to 17-year-olds. It's a fancy website, and it looks like Big Motive did pretty well out of the BBC pandemic simulation. Going back to the BBC Pandemic website, I just want to say a bit about the broadcast dates for this programme. It first went out on BBC4 at 9 PM on March the 22nd, 2018. Now, I don't remember seeing it then, and it's the kind of thing that would have attracted my attention. BBC4 is not one of the main channels, it's something of a niche geeky channel. There's a lot of good stuff on there, but my guess is that this programme didn't reach a wide audience when it was first broadcast. I had a look for reviews of the show written at the time, and the only one I could find was this catty little number by Lucy Mangan in The Guardian. She says, "The pandemic modelling experiment recruited people from all over the country, but turned out to be miraculously pedestrian." And that sets the tone for the whole piece. But the thing that really strikes me about this article is the publicity shot credited to BBC/360 production. This is Hannah's co-presenter from the show, Dr. Javed Abdul-Munaim, visiting a vaccine factory. He's all togged up in PPE garb and sporting the now all too familiar blue magic mask that gapes around the edges and yet still inexplicably prevents the transmission of airborne pathogens. On the same day the programme was first broadcast, this paper was published in the journal Epidemics. Contagion, the BBC4 pandemic, the model behind the documentary, authored by 3 of the mathematicians on the team. I'll come on to this later, but first I want to go back to these broadcast dates. The programme was next shown on Tuesday the 11th of February 2020. Now this is the one that got my attention, and my guess is that it reached a much larger audience this time for obvious reasons. By the beginning of February, tension was starting to build about the possible spread of what was then called a novel coronavirus. Interestingly, it was on February the 11th, 2020, that the World Health Organization announced the official new name for the disease as COVID-19, and people were on tenterhooks wondering what would happen next. So, the BBC pandemic programme was still fresh in my mind on the morning of the 29th of February, when I heard on the radio that the first case of community transmission in the UK had been detected in the town of Haslemere. I remember that moment vividly. It was like I had missed my footing in a shallow pool of water and suddenly slipped out of my depth. I wonder if any of the team behind the BBC pandemic documentary felt the same way. My guess is that they did, but then soon dismissed it as a strange coincidence. But I couldn't do that. I had questions. My first question being, how was the town of Haslemere chosen for the BBC pandemic simulation experiment? I'll say straight out that my investigations didn't provide a definitive answer to this, but I did discover a few interesting clues along the way. First of all, I'll say with confidence that I don't think it was Hannah Fry's idea, despite her being credited with masterminding the experiment. My hunch is that she was brought in at a later stage to front the show. I have also ruled out the mathematicians who appeared alongside her in the studio, and here's why. This paper was written by 3 of Hannah's maths team. It's a major piece of work, and I can't pretend to understand the complex technicalities of the modelling. It says here that as the maths team, we were asked to use the data from the app to build and run a model of how the pandemic would spread. The headline results are presented in the TV show. This sounds to me like they were simply presented with the mobile phone data once it had been gathered, and that they weren't involved with setting up the Haslemere scenario. A search for the word Haslemere brings up 12 results. These paragraphs in the introduction are interesting, but I'll come back to them later. Here's the telling bit. We attempted to make the transmission model as realistic as possible, but due to the programme narrative, some liberties were taken. In particular, we were asked to ensure that the epidemic was seeded in Haslemere. We were asked to ensure that the epidemic was seeded in Haslemere. So, the choice of Haslemere clearly wasn't the decision of the maths team. And there's more. It is commonly believed that these epidemic establishment sites are likely to be major population centres, but the evidence for this is far from clear. Gog et al., 2014 for example, note that the autumn 2009 H1N1 PDM influenza pandemic wave in the United States appears to have been initiated in a relatively minor city. So, while the single introduction in Haslemere may be contrived, there is no reason to reject the possibility of a major outbreak being introduced in such a town. This word contrived is interesting. It suggests to me that the team were scratching their heads about the choice of Haslemere as the location of patient 0. Going back to the introduction, it says this virtual outbreak was to start in Haslemere, a town in Surrey in the south of England, to follow the programme's narrative, with the documentary's presenter acting as a hypothetical index case. And here it mentions a companion paper authored by Kisler et al. 2018b. Detailed data from Haslemere form the basis for an individual-based model used to simulate an outbreak in Haslemere that was to seed the virtual national outbreak. The companion paper is mentioned again here. To meet the tight production and filming deadlines, we had to make quick decisions, often responding to requested outputs and changes in under a day. The bulk of our work here took place in 3 weeks, starting from the maths team finishing modelling and filming for the previous part of the programme, the part on the Haslemere outbreak, Kisler et al. 2018b. So, what is this companion paper? It sounds important as it is referenced twice in the introduction. Going to the list of references, we find the paper is called Contagion, the BBC4 Pandemic, Infecting Haslemere. It's published in the journal Epidemics, and the lead author is Stephen Kisler. But when I click on the link, this happens, whereas all the other papers have active links. When I tried to hunt this paper down by the internet, I could find neither hide nor hair of it, so I decided to contact the author to ask for a copy. And I was very pleased to receive a speedy reply. Here it is. Thanks for your interest in the work. You can find the text here and the underlying data here. Unfortunately, that was a miscitation in the original article, but this linked manuscript contains all the information that was referenced in the article by Peacock et al. And here's the paper he sent. There are a few things about it that jump out straight away. The first is that it was posted on May the 12th, 2020, more than 2 years after the BBC Pandemic companion paper. The next is that the title has been changed to Sparking the BBC4 Pandemic, Leveraging Citizen Science and Mobile Phones to Model the Spread of Disease. The third is that it has gained an author, Andrew J.K. Conlon. And finally, this article is a preprint and has not been certified by peer review. Now, I'm pretty confident that the original companion paper, Infecting Haslemere, had been peer reviewed and was either published or at least cleared for publication in the Epidemics Journal in 2018. So it strikes me as odd that this one has not gained full approval. Despite this, I do believe that this paper is pretty much the one that was referenced in the article by Peacock et al. The tone of it sounds as though the bulk of it was written prior to the 2020 pandemic, but certain things have clearly been altered, removed or inserted. Going back to Stephen Kisler's email, the word miscitation sounds evasive to me, but I didn't want to press him further on that, so I emailed him back to say, "Thank you very much for this, it will keep me busy for a while. I am trying to compare the BBC4 pandemic model from 2018 with the real world spread of COVID in 2020. Haslemere is a significant point on the map in both cases. I wasn't expecting him to reply, but he did. Indeed, we were shocked when Haslemere popped up in the early transmission of the COVID pandemic. I'd be very curious to hear what you find. We were shocked when Haslemere popped up in the early transmission of the COVID pandemic. This sounds genuine, and the use of the word we suggests that the maths team had talked about it amongst themselves. Here is my theory about the missing companion paper infecting Haslemere. The authors had submitted it to the Epidemics Journal. It had been peer-reviewed and was clear for publication. The paper was scheduled to be published on March the 22nd, 2018, alongside the main paper entitled The Model Behind the Documentary, and so they felt confident about citing it in that paper. Hyperlinks to the companion paper were set up, and the two were all set to appear in Epidemics on the day the programme was broadcast. My hunch is that the companion paper was pulled at the last minute by the UK Editor-in-Chief of the Epidemics Journal. The current Editor-in-Chief for the UK is Professor Stephen Riley. He is Professor of Infectious Disease Dynamics at Imperial College London. He is also a member of the Scientific Pandemic Influenza Group on Modelling, SPI-M, which advises the government on the UK's response to the coronavirus. And from the early days of the COVID pandemic, he has been a prominent voice in the media.
So as far as you're concerned, the government is doing all it needs to do in terms of health service capacity?
I think that's a bit simplistic. I don't really think it's just the government. I think if we really want to be sure that we're gonna that the capacity in the NHS is gonna be okay, it's down to us as much as the government to really adhere. The biggest uncertainties that we have in the modelling at the moment are the level of adherence to these stay-at-home requests. So I would phrase it more that way, I think.
And so what do you make of the ongoing political debate around the extent of the stay-home instruction and whether workers who are non-essential workers or not key workers should continue to go to work? How does that change your predictions?
So in this short period of time, when we've kind of committed to doing some really stringent interventions, we just need the best possible adherence, and we appreciate that's easier for some people than it is for others. But if we do it really well over the next 2 to 3 weeks, we'll have a much better idea of what we can do after that. So,
the next 2 to 3 weeks, indeed. But was Professor Riley Editor-in-Chief at Epidemics in early 2018 when the BBC pandemic paper was approved for publication? The Epidemics website doesn't say when he was appointed to the role, so I've had to do a bit of digging to find out. Here's the Wikipedia page for the Epidemics Journal. It says that one of the founding editors was Professor Neil Ferguson. Yes, that Neil Ferguson. Using the Wayback Machine, I discovered that Neil Ferguson was still Editor-in-Chief when the BBC Pandemic Simulation Experiment paper was published, and he stayed in the job until the beginning of 2020, at which point his close colleague at Imperial College London, Professor Riley, took over the reins. They were both major players of the SAGE group during the early months of 2020, and they are both credited with influencing the UK government to abandon its robust pandemic preparedness strategy, which had been painstakingly developed over many years, and dramatically switch course to emergency full-blown lockdown. After exhausting all the avenues of the 2018 BBC pandemic simulation exercise, my next question was, how did Haslemere hit the headlines as the location of the UK's real patient zero at the end of February 2020? To explore this, I put together a timeline of how the story unfolded in the mainstream media. First up is this report by Surrey Live, published at around midday on the 28th of February 2020. It gives us a pretty clear picture of what happened at the health centre that morning. A patient in the centre said they were sat waiting for an appointment when the centre announced it would be closing with immediate effect at 8:50 a.m. There is no suggestion that anyone infected with coronavirus has been to the site, and the closure is likely a precaution. However, the health centre would not comment other than to confirm its closure. This naturally led to speculation on social media throughout the day that there was something COVID related going on, but no official confirmation was forthcoming. It wasn't until around 7 p.m. that Chris Whitty, the Chief Medical Officer, issued a very short press release. One further patient in England has tested positive for COVID-19. The virus was passed on in the UK. It is not yet clear whether they contracted it directly or indirectly from an individual who had recently returned from abroad. This statement had been expected by 2 p.m, so it was over 5 hours late, and it gave no details about the location of the patient, leading to much fretful carping on Twitter late into the evening. Moving on, we find that Chris Whitty's statement was quickly picked up by the Science Media Centre. The Science Media Centre is a UK-based registered charity which pitches itself as an independent press office helping to ensure that the public have access to the best scientific evidence and expertise through the news media when science hits the headlines. When science hits the news agenda, it's our job to pass on to journalists as much accurate information as we can as quickly as possible. Now, I've had dealings with the Science Media Centre in the past, and I worked the encounter into a comic strip. But here I'll just say that some of the information they put out there isn't nearly as accurate and evidence-based as they'd have you believe. One of the main services provided by the Science Media Centre website is the Roundups and Rapid Reactions section. This is where mainstream journalists head for expert reaction to the latest science stories that are likely to hit the news. There's a bit of tail wagging the dog here because the Science Media Centre often puts out lead stories for journalists to find. So if you come across a quote from an expert in a news article you're reading, it may sound like the journalist has sourced the quote directly from the experts, but the chances are it has come from here. Many BBC reports are peppered with quotes lifted from the Science Media Centre. On the 28th of February 2020, we find expert reaction to new UK case of COVID-19 where transmission occurred within the UK. And we have 3 experts commenting on the story. One of them is Jonathan Ball, Professor of Molecular Virology at the University of Nottingham. I'll come back to him later, but for now I just want to say that I've read through all 3 of these statements and nowhere is there any mention of Haslemere or Surrey. Then at 10:32 p.m, Haslemere First put out this statement. This evening, the BBC reported a patient at Haslemere Health Centre, which has been closed for deep cleaning since this morning, is the first to be reported to be infected with the coronavirus in the UK. BBC article here. When I click on the link to the BBC article, it says it was published on the 29th of February 2020. But it's clear that the connection between the closure of the Hazelmere Health Centre and the case reported in Chris Whitty's press release had been made by the BBC sometime before 10:32 p.m. on Friday the 28th. My research has uncovered one more detail of note from that day, and it was recorded a few days later in Hansard on Tuesday the 3rd of March. Hansard is a substantially verbatim report of what is said in Parliament. Members' words are recorded and then edited to remove repetitions and obvious mistakes, albeit without taking away from the meaning of what is said. Jeremy Hunt was Secretary of State for Health at the time of the BBC pandemic simulation experiment, and he is MP for South West Surrey. Here he is addressing the then incumbent Health Secretary, Matt Hancock. I would like to commend the Health Secretary for the calm way in which he has been dealing with this crisis and for his very clear public messaging. He called me last Friday to tell me that there had been a coronavirus outbreak in my constituency. I would like to thank the staff at Hazelmere Health Centre for their extraordinary commitment in working over the weekend so that the health centre could be open again on Monday morning. From this, we know that on the 20th of February 2020, Matt Hancock phoned Jeremy Hunt to tell him of an outbreak on his patch. The word outbreak is interesting because on that date there had, in fact, been only one confirmed case in his constituency. The reason this word jumps out for me is that it has echoes of the BBC Pandemic Hazelmere Outbreak app. Did Matt Hancock really use this word in his conversation to Jeremy Hunt? And what exactly did they discuss? I'll move on now to the BBC article dated Saturday the 29th of February. This was the morning I first heard the news about Hazelmere on the radio. The first thing I notice is that there is no journalist name at the top, but further down is an inset analysis by senior health correspondent James Gallagher, so I'm guessing he's the guy. It is illustrated with these moody shots of Hazelmere Health Centre in the dark. These were taken on the Friday evening and are accredited to a photographer at the Press Association. It is quite a long article, but there is no mention of the spooky coincidence that Hazelmere had also been the location of filming for the BBC pandemic experiment. This connection was made by other media outlets over the following days, in particular the Sunday papers on the 1st of March. Here is the quote from Jonathan Ball, which has been lifted from the Science Media Centre website. Professor Jonathan Ball, from the University of Nottingham, said the Surrey case marks a new chapter for the UK. A bit of liberty has been taken here because this implies he mentions Surrey, and yet this detail was not included in the original quote. But the next paragraph is verbatim. This was always a concern. This is a virus that frequently causes symptoms very similar to mild flu or a common cold, and it's easily transmitted from person to person. This means that it can go under the radar, the virology expert added. Under the radar? I wanted to know more, so I did some digging. In early 2020, Public Health England began issuing guidance on the investigation and initial clinical management of possible cases of novel coronavirus infection. This guidance was updated frequently during the following weeks and months, but here's the relevant page for the 25th of February, just 3 days before the Hazelmere case was reported by the BBC. At this time, very few people in the UK were being tested for SARS-CoV-2 due to the stringent testing criteria put in place by Public Health England. A patient had to satisfy both epidemiological and clinical criteria to be eligible for a test. The epidemiological criteria being: in the 14 days before the onset of illness, travel to specified countries and areas. This includes transit for any length of time in these countries, or contact with confirmed cases of COVID-19. And yet, the Hazelmere patient made headlines because he had not travelled abroad or had contact with a confirmed case. The restrictions on testing in place at the time means that by definition, a case of community transmission within the UK could not be detected. So how was it that Hazelmere, of all places, became known as the location of UK's patient zero?
It was a bit unusual to think that Hazelmere could be sort of the first place that it's been transmitted without an obvious cause.
I decided to email Professor Ball to ask if he could shed some more light on the Hazelmere case. I am currently researching the early days of the COVID-19 outbreak in the UK, and I have a couple of questions to run by you. On the 20th of February 2020, the press announced that a man from Hazelmere, Surrey, had been identified as the 20th case in the UK. The BBC reported this as particularly significant because he was the first to catch it in the UK, but given the way events unfolded from then on, I wonder if this is true. At the time, you said, this case, a person testing positive for novel coronavirus with no known link to an affected area or known case, marks a new chapter for the UK, and it will be crucial to understand where the infection came from to try and prevent more extensive spread. This was always a real possibility and one of the reasons that the government introduced more extensive surveillance. I'm curious to know, 1. What was the more extensive surveillance introduced by the government? I seem to remember that it had something to do with GPs keeping a lookout for potential cases in their patients and presumably taking swabs for testing, but I can't find much about this on the internet. Do you know if this was how the Hazelmere case was identified? 2. You said it will be crucial to understand where the infection came from. This led to headlines in the press about the hunt for patient zero. Events moved quickly after that, and the story was soon forgotten. Do you know if the source of infection was ever traced in the Hazelmere case? Any light you can spread on this pivotal moment in the COVID pandemic will be much appreciated. And here's his reply. He didn't really answer my questions, but the extra evidence he sent was very useful. We did a look-back study and found an earlier case of community-acquired COVID. February 21st, she was admitted to hospital. She would have contracted the virus much earlier, early Feb. Also, we show that the virus strain she was infected with was very prevalent in various parts of the UK subsequently, suggesting quite early introductions. Here's the paper. I've read through this paper, published on the 16th of June 2021, and I am confident that it provides extremely robust evidence that community transmission was indeed taking place long before the Hazelmere case was identified. This report in the Metro summarises it nicely. The results suggest the virus was already circulating widely in local communities in the UK in early February and into March, and was undetected because of restrictive case definitions that informed testing policy at the time. Which means that the Hazelmere case was nowhere near the first community transmission in the UK. So how come it was picked up before any of the others? I emailed Professor Ball again to press him further on the GP testing I seem to recall from the time. Here is his reply. I think SARS-2 Sentinel testing came in around that time. It was 100 surgeries and some hospitals. I don't know any details about the Surrey case. And here's the answer. This article was published on the 26th of February 2020, and it says, a network of 100 primary care sites across England will carry out opportunistic testing for coronavirus in patients with respiratory infections as part of an NHS surveillance strategy. The scheme aims to pick up early evidence if COVID-19 cases begin to spread in England to help the NHS prepare for and prevent wider transmission. So, the only sensible conclusion must be that Hazelmere Health Centre was one of the 100 primary care sites carrying out opportunistic testing for coronavirus in patients from the 26th of February, and, perhaps unsurprisingly, they found a case straight away. To put the number 100 into perspective, there are around 7,000 GP practices in England and around 9,000 in the UK. Was Hazelmere really the only surgery in the scheme to pick up a case of coronavirus by the 28th of February? Somehow I doubt it, and yet it found its way into the headlines as the location of the UK's index case. The first sample to test positive for SARS-CoV-2 in the UK was on the 31st of January 2020. Throughout February, another 18 samples returned a positive result. Hazelmere was the 20th case on Friday the 28th of February. On Sunday the 1st of March, Chris Whitty put out another press release to say that as of 9 AM this morning, 12 further patients in England have tested positive for COVID-19. From that date onwards, a tally of positive test results was published each day, and the solemn drumbeat of case count and death toll became a familiar background rhythm to all of our lives. Taking everything that I've uncovered into account, I've come to the conclusion that the Hazelmere coincidence did not happen by chance. To accept that the pandemic simulation experiment accidentally foretold the exact location of the UK's COVID index case is simply too much of a stretch. The unease expressed by Hannah Fry's maths team about the contrived nature of the Hazelmere scenario is telling, as it suggests that the BBC selected the location without consulting with the modelers to check if the scenario was plausible. Then there's the crazy prescient nature of the whole simulation exercise with its many weird parallels, such as the depiction of the asymptomatic superspreader, the concept of patient zero, and the uncanny correlation between the smartphone app developed for the simulation experiment and the track and trace COVID app downloaded by millions, which caused the 2021 pingdemic. Moving on, the drama surrounding the big reveal of Hazelmere as the location of the UK's first case of community transmission marked a significant shift in gear in the unfolding of the pandemic narrative to one of heightened national anxiety and turmoil. It is now apparent that this moment itself was contrived, as it has since been generally acknowledged that community transmission was well established in the UK by the end of February, which leads me to suspect that this whole episode was nothing more nor less than hackneyed theatre. Behind the scenes there is jiggery-pokery at play, which means that someone in the background somewhere is pulling the strings. Whoever this is, I am sure they are extremely happy to have flawlessly pulled off an illusion worthy of Derren Brown.
Welcome to Apocalypse.
Except, of course, this is not a stage show. This is people's lives.
Well, right. Well, can I tell you, for the record, that her colour is very poor, You know, she's quite blue around the lips, and her breathing is quite fast, and that's, to me, that is a cause for concern.
Well, like I say, we've not had any concerns with her.
Well, I know, but you never do have concerns for her. Do you know, with respect, you don't. You know, I understand you're doing your best, but, you know, I can see that my mother is not well just by looking at her through the window.
Well, all I can suggest is that you ring up on Monday morning.
Well, what do you mean I ring up on Monday morning? That's 2 whole days away.
Well, like I say, I'm not the manager. So
you're not the manager, but I mean, hang on a minute, just a minute before you go. I am asking you. I want this doctor. Hang on a minute. Don't take her away. Hey! Don't take her away! Don't take her away! Don't take her away! You bastards! You absolute bastards! Oh, God.
These visiting pods that they're getting your family to visit the residents, and I'm just going to show you what a visiting pod looks like and how inhumane it is. Okay, I will be posting this video up to Instagram at some point because I am at the end of my tether now. I will be leaving this job at some point because I literally, my heart and soul can't take it. I can't watch this unfold around me anymore. I'm in through the door. That's the door. Looks like a fucking cell door. Yeah, got to see your fucking family through a fucking screen, mate. Yeah, and you've got to talk to them like this. You've got to talk to them like that. That's how you talk to someone on the other side. This is sick. This is sick. This is fucking sick, mate. It's been a stressful couple of months, but honestly, I can't. This just doesn't sit right with me, mate. This doesn't sit right in my gut. Look at it. Look at it. It's like a fucking visiting room in a prison. Look. Look. This is not okay. This is not okay. For anyone who thinks this is okay, it's not okay.
Now, I know that most people in the UK will never accept any of this. They will continue to insist it is just a coincidence, nothing to see here. And I ask myself, how was the population of Britain so easily led a merry dance down a very dark alley? I wonder. Next time I explore the mysteries and symbolism of the peacock feather.
And I recommend that you stop watching the news, because the news contrives to frighten you, to make you feel small and alone, to make you feel that your mind isn't your own. I spent the day in bed. It's a consolation when all my dreams are perfectly legal in sheets for which I paid. I am now late and I recommend to all of my friends that they stop watching the news, because the news contrives to frighten you.